Hi, this is Dr. Karen Perez, and today we'll be discussing about informed consent, what it is, what is a nurse's role, what are the intricate of informed consent. So stay tuned.
Informed consent. This is a huge one also too. Identify appropriate person to provide informed consent for a client. So remember is that it is a person who's going to do the procedure. It's their responsibility to ensure that the informed consent is signed, because the nurse witnesses the informed consent. Her signature, his or her signature is not the main signature. So provide written material in the client's spoken language is that if an informed consent is given, then it should, and the person speak Arabic or the person speaks Spanish or Creole, then it should be given in that language in which the client speaks. Describe component of the informed consent. So there are different components and we're going to go inside them a little later on. Participate in obtaining informed consent. So the nurse participates in obtaining the informed consent, but it's not their responsibility to sign the consent for the procedure. They witness the consent. Verify the client receive appropriate education and consent for care and for the procedure that's going to take place. So, an informed consent. A lot of times people think that an informed consent is that I am giving you the consent to treat me. Yes, that's slightly right, but not completely. A client agrees to accept a course of treatment or procedure after receiving complete information. So the informed consent is like information. I receive the information, so I'm giving my consent. So that's why it's called informed consent, because it is saying that they got the information and so they can make a clear judgment or give their consent for treatment. So again, is that the client agree to accept a course of action or procedure after receiving complete information. And this information includes what are the risks of the procedure? What is the benefit of the procedure? What is the alternative? Is there any other alternative to treatment? And what is the prognosis? And all of these are part of the informed consent. And again, an informed consent is saying that I am informed, so now I'm giving you my consent to treat. So, basic requirement. So, the patient must have the capacity. What the capacity means, they're talking about the cognitive ability to understand. These are the basic requirements. They must have the cognitive ability to understand what's on the informed consent. And it must be voluntarily, meaning that a patient should not be forced into, yeah, do the surgery. You're going to die if you don't get it done. You're going to lose this if this doesn't happen. They should not be forced or coerced into doing the surgery and signing the form. They must have the information to make a conscious or an educated decision. So these are the basic requirements. They must have the capacity. They must have they must sign the paper voluntarily, and they must have the information, which is education. About the capacity, I mean, capacity is a broad word in that it could be that the person has mental challenges that prohibits them from understanding. That falls into capacity. So a guardian can make the decision for them. But capacity could also be that normally before surgery, they'll give the patient something to calm the person down, some Ativan or something like that. And this, when a person gets any kind of opioids medication that can impair their alertness or their sense of capacity, then they cannot sign the informed consent. So the nurse would have to make sure that the patient has the form and sign the form before giving any pre-surgical meds or any medication that can have them drowsy, groggy, and stuff like that, because that is considered lacking capacity to sign the paper also. So capacity is not only mental issues as it relates to a diagnosis or a mental illness. It also has to do with giving the person the drug. The person then become lethargic, sleepy, dizzy, and all of that. That will bar them from signing the paper. Okay. And if a person receive informed consent when they're drowsy, then it's not considered valid. The client must understand the purpose of the procedure and the expected results. Here's the purpose of the procedure. Here's what we expect to happen. Anticipated risks, discomforts, potential benefits, any reasonable alternative, and that the consent may be withdrawn at any time. That's one of the thing about consent. So even if the person is on the stretcher heading to the OR and they say underneath influence of Ativan, oh, I don't want to have the surgery anymore, they can change their mind about the surgery anytime. And they need to know that they have that right to withdraw at any time. The care provider has the legal obligation to obtain the informed consent for medical treatment, but the nurse should confirm the consent and answer the client's question. And answer the client question is a huge area, because if the client says, if the nurse asks, which foot are you going to have amputated? And the client say left while it's right. Then the nurse needs to get the doctor in. The nurse needs to get the doctor in to explain further to the patient. So this part is very important, that the care provider has a legal obligation to obtain the informed consent for medical treatment, but the nurse should confirm that the consent is signed and should answer the question that the client has. Some question, because the nurse is not the surgeon. The nurse is not the surgeon and cannot answer information about the surgery. Okay?
Thank you so much for watching. If you have any question or comments, please make your comments or ask your question below. In addition to that, my email address is listed below, so please shoot me an email if you'd like. Thank you so much. Stay tuned for more informational videos.